Pictures and videos, too.
Yes.
Thanks, Gil. Well, there are many ways an organization can support and care for its healthcare workers. And as many employees are working harder and longer hours, it's important to build tools for wellness and provide education on how and where to get help. Here today to discuss employee well-being is Dr. Jennifer Ferrand, a clinical health psychologist and director of well-being at Hartford HealthCare. Welcome.
Thank you so much for having me today.
This is such an important topic, our healthcare heroes. So how has this recent COVID-19 surge impacted healthcare employees again?
Well, you know, it's important to remember that healthcare workers are humans first, and we're not immune to human problems like getting sick ourselves or having to cope with complicated personal lives, all while managing the demands of our professional roles in a time when we're experiencing staffing shortages or higher volumes of patients to care for. So nationally, we're seeing a significant increase in the rates of clinicians and healthcare workers that are reporting symptoms of exhaustion, depression, sleep disorders, and post-traumatic stress, with the nurses being equally, if not more, stressed. And this is an increase from pre-pandemic levels and is something we need to address as a healthcare system.
All right, tell us how Hartford HealthCare has supported its healthcare heroes.
So Hartford HealthCare was poised to do this work long before the pandemic erupted and has invested in healthcare worker well-being by hiring a chief wellness officer and working to make culture change, remove barriers to people's ability to work safely and efficiently, and help the organization maintain resilience during and outside of crisis. So specifically, we've done this in a couple of ways during the pandemic. First is that we help people assess where they're at and how they're feeling, because just like you can't address high blood pressure without knowing you have it, we also can't address burnout or distress without being aware of it. We've also helped people to address their distress by providing resources and education and support directly to people. And we destigmatize all of this, and we encourage people to accept help. We support our leaders to monitor their own well-being and model good health behaviors for our colleagues and recognize when someone needs help. And lastly, we think it's important to acknowledge and recognize the sacrifices and commitments that healthcare workers have made these past 22 months. So we practice showing gratitude and recognition and saying thank you in as many meaningful ways as we can.
All right, and we just have 30 seconds left. Tell us about the Hartford HealthCare Wellbeing app.
So we've learned during the pandemic that our workforce doesn't have time to access information or digest complex information. So we focused on a communication that puts simple and clear information and resources right into people's hands. And we're providing our colleagues a way to assess their distress level, access resources like guided meditation, and connect with our well-being department for support through mobile technology.
All right, Hartford HealthCare, Dr. Jennifer Ferrand, thank you for joining us. Keep up the good work.
Thanks so much.